Hello out there in television land. Welcome to yet another edition of It's Your Health. This is the summer edition. We're going to talk about the landmines of navigating through this summer activities. I'm with the Fipster here, my son. And you have anything to say for the opening?
Anything we talk about here, make sure you talk about it with your healthcare provider before implementing anything we do.
Good advice. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. We're back with the first segment of It's Your Health, the fastest 30 minutes, and we're going to prove it right now, right, Fipster?
That's right. Let's get started with some riveting headlines.
Okay.
Moving on. Prediabetes linked to stroke risk. Some recent studies, which are numerous, have linked prediabetes, or people who are not quite diabetic yet but are on their way, have a greater increased risk of stroke.
Right. A so-called metabolic syndrome. I don't think you just wake up with diabetes. Of course, you can sometimes. But what more often happens is you inherited the trait for diabetes, you fed that trait by overfeeding yourself, and are on the boundary, if you will. We used to call it borderline diabetes. And these people are at high risk for vascular events because this is a vascular disease. So the way to diagnose it used to be the old glucose tolerance test. I don't know, is the hemoglobin A1C now kind of one of those things? How do you diagnose this person?
I don't know. I think the problem is the hemoglobin A1C will catch someone that might be a pre-diabetic, but it might not. The best way is to do a postprandial blood sugar 2 hours after you're eating, and see that your body is not responding to the sugar load right and you're not secreting insulin properly. And then we'll see that rise in the blood sugar, and then sometimes we'll see a drop, and that person will say, well, I always had low blood sugar. And that's actually, low blood sugar is in many ways a pre-diabetic condition. And so I think that's a better way to pick up on it.
Sounds like good advice. And of course, it's an epidemic these days in this country.
Moving on to headline 2. Drinking coffee may delay Alzheimer's.
Yeah, I kind of like this because I like my coffee, although not too much. Most of us have a cup or two a day. And it was kind of like eating meat on Friday. It was a sin, now it's not a sin. Before, caffeine was considered to be a bugaboo, but now, the more they investigate it, caffeine is actually a healthful drug, if you will.
Yeah, I think it's very interesting. There's been a lot, at least recently, supporting data for the coffee drinkers. And being a coffee drinker myself, I look forward to that.
You read those headlines.
That's right. Third headline, FDA approves HORIZANT for post-shingles pain. HORIZANT's a new version of gabapentin or Neurontin, which is an old anti-seizure medication that now has been formulated to work better for shingles.
Right, you don't want to have this kind of pain because as the shingles virus crawls down the nerve, it strips off the coating of that nerve, almost as though you strip the wire off an electrical cord, and it just burns incessantly. It can take weeks, months, maybe years to get over. Some people actually do themselves in because of the pain. Were we going to talk a little bit more about shingles here?
I think it would be a good time, yeah. I think it would be a good time to kind of
here's a couple of pictures of shingles. What's this first one, Phil?
This is the backside of someone who has a very classic vesicular pattern. You'll see it has a tree branch-like pattern, and you'll always see it on one side of the body. And those are the kind of the key diagnostic features for shingles, is there can be some redness or some vesicles or fluid-filled sac. The sacs will be clear fluid. Initially it can burn. Sometimes you have some burning or tingling before the rash starts, but anytime you see a unilateral rash in one area of the body as opposed to all over, shingles is definitely a possibility.
And this second view here of this person, a little bit more extensive.
Yeah, this is someone that's, you know, an older gentleman. They're going to have a lot more problems because it's over the face. That could be affecting his eye. That's something that requires a very urgent consultation. And
can be prevented. Talk to your doctor about getting a shingles vaccine.
Yeah, it's spawned from the chickenpox vaccine for children. We now have Zostavax, which is now being more and more covered by insurances. It's often covered at the pharmacy level. Sometimes it's covered at our level, depending on your age and insurance. Definitely worth looking into. It can prevent up to 80% of outbreaks of shingles, and if you've ever ran into someone with shingles, you can talk to them. If they could have done something to prevent it, they would have.
There's no doubt about that. Speaking of preventive, now that the sun is shining.
It is hot. It is shining. Let's talk about sunscreen. There's been some recent upheaval. Sunscreens, some are not healthy, some are healthy. Some say they're SPF 70, some say there aren't. I was reading some recent articles, and one of the ones that was very interesting is it showed that whether you're a child or not, the ones that are children-based are actually safer. They contain less chemicals as opposed to minerals like zinc oxide, which are safer for you. They're truer to the SPF value, and they tend to stay on longer.
Right. And of course, prevention is the most thing. But you can be out there for about a half an hour with today's sun and really get a burn, particularly if you're exposed to, if the sun is exposed to areas that don't get the sun very often. You know what I'm saying? Because I don't.
I don't know either, but it sounds like it hurts.
It sounds like it hurts.
Let's talk about other things the sun can do and the heat in general. The last couple of weekends, we've been weekend warriors with the wood, and it has really put a hurting on us because despite us drinking plenty of water and working hard, you know, that heat can do something. When's the point where the heat becomes a problem?
I think if you're starting to have symptoms, it's already a problem. And I experience, you know, symptoms of lightheadedness, dizziness. You feel a little weak, a little short of breath. You feel as though something bad's going to happen. And so we would want to curtail the activities at that point, get into a cooler environment, maybe even, you know, sprinkle some water on us, put some ice packs, because you don't want to get into what's called heat stroke.
Yeah, and that's very dangerous. Your core body temperature gets up over 105. The mechanisms and regulatory systems you have just fall apart, much like they fall apart at much lower temperatures. If you're starting to get confused, you're disoriented, these are signs that you better call 911 quick. This isn't something you can just fix at home. You got to get on top of it. You need IV fluids. You're probably dehydrated. There's a bunch of different things that can make this worse. You know, if we're not drinking a lot of water, that's problem number one. Problem two, if we're drinking alcohol. Alcohol's a diuretic and does not do anything to hydrate. It only makes the problem worse. So sitting at the lake, you know, drinking a couple of beers is going to get you in trouble real fast. There's certain medications that also can set you up for heat stroke.
Diuretics, for example, and diabetics in general may not have the proper regulatory system. So big problem this time of year. Again, it's preventable, and that's all I can say about it.
That's the story.
That's
Is that our first segment?
I'm not sure, is it?
It is. We're gonna have to
I told you it's the fastest half hour in television history. Remember, you're watching It's Your Health. It's your leader in healthcare information. We're going to be right back after this brief commercial message. Thank you. Welcome back to the second segment of It's Your Health. Philip Benyo with Philip Benyo, bringing you the best and for free.
Let's dive back into the headlines. Free is the key word. Too free. Moving on. Eat breakfast, cut diabetes risk.
You know, that's something.
This is like me, Tarzan, you Jane. You know, a lot of people think they're trying to lose weight. I'm going to do a healthy thing. I'm going to skip breakfast. I'm going to skip breakfast. And the problem is you end up, the longer you go without a meal, the more likely you're going to make a mistake and overeat or binge eat. And you're going to spike your glucose levels, which means you're going to spike your insulin levels. And this rapid to and fro is what ends up leading to diabetes later on. And so what they're recommending is that we need to eat more often. And so breakfast is one of those key meals.
Yeah, and I wish I could get into that, because I get up early, I have a cup of coffee, and next thing you know, when's lunch? Yeah. And so one of the key ways of losing weight is to eat, believe it or not, but we would call it grazing. And if you graze throughout the day, your body won't think that there's a world war or famine outside and decide to lower your metabolism. So eat your way to health.
I tell people to never be hungry, but never be full. And if you can stay in that perfect balance, you really can get your metabolism rolling and lose some weight fast.
I like that. I like that. Never be hungry, never be full.
Moving on. Low B6 linked to inflammation. Some recent researchers were looking at different inflammatory markers, and one thing that they found for patients who had increased inflammation throughout their body, whether it be joint or tissue inflammation, they all had one commonality, and that's they had low B6.
Again, our diets are not hunter and gatherer diets anymore. They're processed foods. We're lacking a lot of the B complex vitamins. And a lot of the diseases that ravage our bodies are inflammatory diseases, the cardiovascular ones, the diabetic things, the hypertension, all vascular entities, including arthritis. So get on to the Bs, and that's another key thing for fish oils. Fish oils are probably the most potent anti-inflammatories that God has created, so keep that in mind.
Pretty cool stuff. Last one. FDA approves the generic version of PLAVIX.
Yeah.
It's finally here. It actually was here, and then it wasn't, you know, for a couple of months about 4 years ago.
PLAVIX, people don't like it because it's expensive. You sometimes can't take your stomach medications with it. But tell us a little bit more about the generic PLAVIX.
Well, there's 7 different companies that were approved by the FDA for generic PLAVIX. It's going to be much less in price, which means your prescription plan will be much more friendly with PLAVIX. Most people, when PLAVIX first came out, it was only ever intended to be maybe used for a year or two. Now, with the stents that they're putting in people's hearts, we're usually on PLAVIX lifetime. We actually don't see a lot of people getting off PLAVIX now, so the expenses lifetime it can be great. You know, this is something that the branded drug, I think, is, you know, close to $150 a month.
Right.
So for those people who hit the donut hole, the generic PLAVIX is going to make it a lot easier towards the end of the year.
And PLAVIX, of course, is usually taken with aspirin. They're anti-platelet, kind of blood thinners, if you will. They're strong, but not too strong, but strong enough that you need blood tests every so often, because bad things can happen on these drugs.
Let's talk about some of the things that we use these drugs for, namely strokes and TIAs, and you know what the difference between those are. You know, I hear often people say, "Well, I just had a mini stroke. I'm okay, right? I don't need to do anything." You know, what are we talking about here?
Well, TIA, transient ischemic attack. As the name implies, the attack is transient, and if it involves the brain, of course, which is what TIAs generally do, it can affect the area wherever that blood clot decided to reside in your brain. If it is the area that involves your right arm and your right leg, they may go weak or numb. It could involve your speech. It could involve your eye. People classically say there's a window shade going over my eye. Aspirin, of course, will help to lower the risk of TIAs. Of course, you need to also lower your cholesterol, lower your blood pressure, stop smoking, and control your blood sugar if that's an issue as well. So that's the transient ischemic attack. Usually it's due to a blood clot, sometimes from here, these blood vessels, sometimes from your heart if it's skipping beats, or from a heart valve. Tell us what the consequences of TIAs.
Well, TIA is, you know, the storm on the horizon, and it's rare people get away with one TIA and nothing else and live a normal, happy life without any intervention. If you've had a TIA, your chance of having a second TIA or a full-blown stroke is greatly increased. And you know, the difference between a stroke and a TIA is the stroke doesn't go away. You know, the stroke is going to cause, you know, debilitation, death. You know, put people in nursing homes. You know, it's something that will take your independence and just ruin it. And it can really destroy a family when a family member has a stroke, because you have someone who's very independent now that's not, and they don't get better. So our goal is to really try to prevent these things from happening, not treat them once they do. If you look, there's a nice little list we have of the different major causes of stroke. You went over the real key ones. Let's talk about, you know, you brought up lowering cholesterol, being on aspirin. I think those are important things. It's important to maybe be on a statin if your cholesterol is high, but let's say you can't tolerate that statin. Here's a nice list of some of the other things you can take to help lower your cholesterol. That's a helpful thing.
Yeah, get a load of this. These are natural things, because people don't like statins. It's hard for me to somehow convince someone to take these medications. They perceive side effects that aren't there, or don't want to get involved with routine blood work every 3 months, or the potential that something bad could happen on these medications. They would rather go natural. But get a load of this list, Phil. Maybe you could talk about it a little bit.
Well, there's a glass of red wine a day. We've talked often about the goods of of liquor, and so but a glass, but no more than 1 glass. You know, that's kind of the cutoff. An apple or 2 a day, increasing the fiber in your diet. Pectin, that's what's in apples. It's listed twice. Skim milk as opposed to regular milk.
Right.
Coenzyme Q10, fish oils, niacin. These are all things that can help lower your cholesterol. Grapefruit is even helpful, but you have to be very careful with grapefruit because there's other medications that grapefruit don't get along with.
Yeah, I would probably take grapefruit off the list because grapefruit and many other prescriptions drug will interact poorly. So you might want to jot that one off. Have the grape.
Have the grape, not the fruit, yeah. There's your wine. All right, let's talk about post-stroke, post-MI. You know, we have an aging population. We are having more and more arthritis. My knee hurts, this, that, all these things. And we're reaching for NSAIDs, or non-steroidal anti-inflammatories. I can grab my ibuprofen. I can grab my Advil. There's a recent Danish study. They looked at 88,000 different Danes who post-MI, post-stroke, had them fill 1 prescription of NSAID and saw what happened. And you know, there's like 25 to 30-fold increases of stroke, heart attack, and atrial fibrillation associated with the NSAIDs, post-MI, post-stroke. These are medications that should really be avoided.
Dangerous drugs over the counter, Motrin, Nuprin, Advil. They will elevate your blood pressure. They can affect your kidneys. They can give you an ulcer. And in the long run, you're going to get bitten by these medications, to say nothing of the prescription non-steroidal anti-inflammatory agents, which we kind of rarely prescribe because you know, those things can really cause cardiovascular or neurologic events, which gets me back again to fish oils. Fish oils in people who take legitimate fish oils, not the ones at the discount centers for $4. They're the ones that a company like Lifeguard, that's the stuff they throw away. They give it to the discounters. But actually the fish oils will lower the inflammatory process like you won't believe. Hardly any side effects that I know of, not even heartburn from these medications. So again, you have to avoid some of these publicized, advertised non-steroidal anti-inflammatory drugs, NSAIDs, because they can be dangerous. But I'll tell you what's not dangerous, watching to It's Your Health. We're completing the second segment. We'll be back for the third segment after this brief commercial message. Remember, you're watching It's Your Health. We're your leader in healthcare information. Welcome back out there in television land to It's Your Health, our final segment. I'm with the Fipster here, who is a font of knowledge today. Is that because your wife's going away? Is that why you're
She went away already.
Oh, that's why.
She went to the beach.
Okay, well, he's batching it for the next couple of days, so...
let's move on.
Let's move on.
Weather triggers migraine headaches. A recent survey of migraine sufferers who took logs of their migraines for a year found that there was a high association with temperature changes in the weather that increased their headaches.
Which temperature changes and which weather changes?
Any temperature change.
Oh, any?
Whether it goes from a hot day to a cold day or a cold day to a hot day, just about anything.
That is interesting. Another list of things that can provoke migraines. Keep in mind chocolate, nuts, sometimes processed meats and foods, red wines are some of the things that can...
You said that stuff was good, though.
That's true.
Moving on. Low vitamin D linked to weight gain in older women.
You know, vitamin D, when's the last time we measured a vitamin D level on a patient who's never had one before and it was normal? When's the last time?
Maybe if they came from Florida or they just returned from Florida, but it's 2 out of 3 have low. If you say even low normal, you know, the cutoff is 32. We might get a couple of people who are 33. The upper limit's 100, so there's all kinds of wiggle room to go higher, and I don't ever remember seeing one that was high.
It is such an endemic feature in our area, probably because we have winter here 6 months out of the year, and we don't get out a lot, and we're more of a sedentary population. But vitamin D is crucial for not only your bone health, but it brings into play these other issues that vitamin D is important for. And again, I hate to fall back on it again, the fish oils have vitamin D in them. already, so you can get your anti-inflammatory things along with your vitamin D by just taking a good quality fish oil.
This was something that we've talked about a lot before, but we're going to talk about it again here. Last headline: CT screens are backed by recommendation committees for heavy smokers between ages 55 to 74.
Right, now a heavy smoker is defined as what?
Someone who's had 30 more pack years. So a pack year is calculated. If you smoke a pack a day for 10 years, that's 10 pack years. 2 packs a day for 10 years, that's 20 pack years. So if you have 30 pack years and you don't have a history of lung cancer, they're recommending a low dose CT, low radiation CT, annually for, I believe, 3 years as a screening test. And they compared this to conventional chest x-rays, which is something we always do. We sometimes will get the CAT scans, but we can generally get chest x-rays once a year. And they were able to reduce the risk of mortality due to lung cancer by 25%.
Yeah, you can't necessarily sleep well with a normal chest x-ray. And the CAT scans we've been doing are showing abnormalities that we didn't even know the patients had. They have nodules, they have scar tissue, and then they need to be followed, as you say, once every 3 years. But of course, maybe you ought to just consider stop smoking. You know what I'm saying?
That's the number one thing they do focus. So rather than look for disease, why don't we do something to prevent it? And the first thing you could do, I don't care if you smoke for 50 years, the day you quit smoking, your risk goes down.
Right. So if you're a 30-pack year smoker out there, you might want to talk to your doctor about ordering a low-dose radiation CAT scan.
Good. Moving on. Let's talk about, we have an aging population. It's baby boomers this, baby boomers that. It is something that has, the amount of preventative health things that we have to do is sometimes overwhelming, at least from a patient standpoint. I have to do this, I have to do that, now I have to have this put in there. Let's kind of get a soup to nuts preventative health, for the aging baby boomer.
Sure. And again, people take better care of their cars than themselves.
Their cats.
They get annual things. The car has to get inspected once a year. But for your annual inspection, we would generally get a complete blood count, a metabolic profile, check your sugar, your cholesterol, your urine. Of course, that would be coupled with a physical exam to include your blood pressure and a prostate exam for you guys out there. And we can't emphasize enough the mammograms, the colonoscopies. These are to screen for cancers that don't have symptoms, because once you have the symptoms, unfortunately, the horse is out of the barn, and then we're really catching up. And I run into women all the time who we have to twist their arms to get a mammogram. Just the other day we had a woman who said, "What do I need that for? I'm in my 70s, and the last one 2 years ago was normal." And we convinced her to go get one, and good luck, bad luck, she has something on there that's going to get taken care of that would otherwise just been left to go. So, I mean, you really need to step up to the plate and look for trouble, if you know what I'm saying.
There's been a lot of reports just recently about specifically the prostate cancer screening. There's a lot of things on TV telling us, oh, we don't need to do it anymore. The U.S. Preventative Services Task Force, which is a 16-member group of people that decide what tests are good and bad, are saying, well, you don't need to even check PSAs, you shouldn't be doing prostate cancer screening. And this kind of came out of really left field because we don't have another way to screen for prostate cancer. And their argument would be that if you just look at the pure numbers, there's a better chance of harming someone with a prostate biopsy than actually saving someone from a prostate cancer death. And I think the number needed to treat was you had to treat 1,000 people to prevent 1 death. And so, those numbers kind of make sense. On our end of it, these numbers and these clinicians, maybe they haven't seen someone who has had prostate cancer spread to their bone. That doesn't kill you, but it really gives you a very painful outlook for a long time. It may take 10 years, but it's not fun. And we don't see it often anymore, but it does happen. I know when I started practicing, you saw it a little bit more, but it's tapered off. And I have to think that's because we do screen for it. We detect these things a lot sooner. Do you have any comments?
There's no doubt. And, guys are really sort of, if it's not broken, don't fix it mentality. But they need to encourage themselves, or others need to encourage them to come in and bend over and smile and make sure they get a prostate exam, because sometimes just getting that done in and of itself, we can detect abnormalities that may not be necessarily detected on a blood screen. And to some degree, the blood screen is just a test. We treat the patient, not the test. So it's important you get in and get examined. Now, what was the issue with the Hep C business in baby boomers?
Well, it's interesting. The CDC, Center for Disease Control, just recently issued a statement saying that we need to do a better job of screening for Hep C in our baby boomers. And I was like, well, wait a second. What are their risk factors? When I think of risk factors for Hep C, I think of IV drug use. I don't see a lot of baby boomers using IV drugs. I think of tattoo use. Too many baby boomers out there getting tattoos, but there are. I think of, certain types of sexual behaviors that can get you in trouble with Hep C. Again, pretty low risk because most of these people are married and in good relationships and monogamous. But however, baby boomers were in an age where we used to use steel needles with glass syringes, and we used to have to sterilize that stuff in between. And they were in an era where blood transfusions never screened for Hep C until the late 80s or mid 80s. So there's a lot of, we actually have a fair amount of older patients with Hep C that we found out either by accident or they came and told us that, oh, by the way, I have Hep C. It is something that is worth screening for, at least once, if you're in that age category.
So we'll be adding that to the list of things to do. And thank you again for allowing us to come into your home and entertain and inform you. Remember, this is It's Your Health, your healthcare provider, and your #1 healthcare information network at Samsung Productions Channel 13. Thank you for watching. Join us again sometime.